Welcome to today's webinar titled Ask TRICARE. We are thrilled to have with us today a panel of experts from the Defense Health Agency. Without further delay, I will turn things over to our first presenter, Amber Butterfield.
Thank you, Terry, and welcome everyone again to the Ask TRICARE webinar. My name is Amber Butterfield, and I'm a healthcare policy analyst with the Medical Benefits and Reimbursement section. I'm joined by a number of my colleagues. We are going to share with you some recent policy updates and answer your TRICARE questions. But before I begin, I'd like to go to the next slide and read you our disclaimer. The appearance of hyperlinks does not constitute endorsement by the Department of Defense of this website or the information, products, or services contained therein. For other than authorized activities such as military exchanges and morale, welfare, and recreation sites, the Department of Defense does not exercise any editorial control over the information you may find at these locations. Such links are provided consistent with the stated purpose of the Department of Defense sponsored webinar. Next slide. So the agenda. We have three policy changes to review with you first, and then we're going to highlight some reminders about keeping your DEERS information up to date and ways you can follow TRICARE changes. Then we'll go into some Q&A. The remaining slides in this presentation include contact information should you have more questions following the webinar. Next slide. So the first policy change I want to share with you is regarding 3D mammography. Effective January 1 of 2020, TRICARE began covering 3D mammography as a preventive healthcare service through the Provisional Coverage Program. And briefly, I'll just tell you about this procedure. It's a breast imaging technique that provides 3D views of the breast tissue to facilitate the screening and diagnosis of breast cancer. DBT is similar to a CT scan that only images the breast. An X-ray source repeatedly sweeps over the breast at regular spaced intervals to obtain cross-sectional slices of the adjacent segments of the tissue. You'll be eligible for the 3D mammography screenings if you are a woman who is age 40 or older, or age 30 or older and higher risk, 15% or more lifetime risk of breast cancer screening. And currently for this benefit, we're asking for you to get a pre-authorization from your regional contractor. We are working to remove that requirement, but as of today, it's still in effect. Next slide. Another provisional coverage benefit that we recently implemented is platelet-rich plasma injections. This was effective October 1 of 2019, and briefly, again, this is how this works is blood is collected from the patient and prepared by spinning it to isolate the platelets, which are then injected into the damaged ligaments, tendons, and joints. The high concentration of the growth factor stimulates an immune response, which stimulates tissue and healing in the targeted area. We are covering this for two indications: mild to moderate chronic osteoarthritis of the knee. And the coverage criteria for that is that you have had to have tried physical therapy, diet, and exercise for 3 months unsuccessfully. And you also have to have radiographic evidence of osteoarthritis. The second coverage indication is lateral epicondylitis, which is also known as tennis elbow. And the coverage criteria for that is evidence of diagnosis on physical exam. And also you have to have tried a 3-month period of physical therapy, diet, and exercise in order to be qualified for that benefit. This is being covered for up to a 5-year period under the Provisional Coverage Program. And during that time, our team will work to develop this benefit so that it can be converted over to the basic program. And again, with this provisional coverage services, you need to contact your contractor for pre-authorization. And with that, I'll turn it over to Dr. Black on the next slide to talk about CPAP.
Thanks, Amber. My name is Jim Black, and I'm a medical director in the Clinical Support Division, in the Defense Health Agency. And as Amber noted, I'm going to be talking about portable, continuous, positive airway pressure, or CPAP machines. And this is for active duty service members, for the treatment of obstructive sleep apnea. The services requested that this be covered for service members. It is not a TRICARE benefit, but the director of DHA does have the authority to waive non-coverage policies for active duty service members only. So working with the service sleep medicine experts, we developed the criteria that you see there in the slide, for travel and for deployment. And these recommendations were approved by the director at the time, that was Vice Admiral Bono. If a service member has been diagnosed with obstructive sleep apnea and has already been provided a standard CPAP machine, if they do meet the criteria, then they can also be provided a portable device. But if they're diagnosed with obstructive sleep apnea and this is their first device, if they do meet criteria, then they get the portable device, but they cannot get a standard device in addition. Next slide. So this slide is to keep your DEERS up to date. This slide is about the Defense Enrollment Eligibility Reporting System, or better known as DEERS, and lists the options for updating information in DEERS. You can make changes in person, online, by phone, and by mail. For you and your family to use TRICARE, you must keep your information up to date in DEERS. Incorrect information in DEERS can cause problems with TRICARE claims and other healthcare benefits. You can visit tricare.mil/DEERS to learn more. If you have questions about your enrollment, you should call your TRICARE regional contractor for assistance. Contact information is available at tricare.mil/regions. Next slide. This is to keep up with TRICARE changes. If you want to keep up with changes happening at TRICARE, here are the different ways that you can stay in the know. You can also sign up for email updates at tricare.mil/subscriptions. We're now ready to begin the Q&A. Thank you. Terry?
Very good. Thank you so much. The first question, what is the Continued Healthcare Benefit Program? Who is eligible and how can you enroll?
Hi. The Continued Healthcare Benefit Program acts as a bridge between military health benefits and your new civilian health plan. It's a premium-based plan that gives temporary insurance coverage for 18 to 36 months when you lose eligibility for TRICARE. And I'm sorry, I did not provide my name. I'm Vonda Lawson. Back to you.
Thank you, Vonda. Next question. If I become ill during foreign travel, will TRICARE cover my expenses? Is there any action required by me prior to the foreign travel that I need to do? For example, notify TRICARE of my travel?
Good afternoon. This is Kim Stakes from the TRICARE Overseas Program Office. And we will go ahead and address this question, but we don't know if the person that asked the question is active duty or a retiree. So we'll go ahead and answer it both ways. But all beneficiaries traveling need to obtain their routine care before they go on travel. If the beneficiary is on travel or traveling overseas and you need urgent or emergent care, you can contact International SOS, which is the overseas contractor, for assistance with finding a provider or facility. And active duty service members and active duty family members traveling will receive that care on a cashless, claimless basis. All other TRICARE beneficiaries will need to pay the bill up front and file for reimbursement through the overseas claims processor. One thing that we like to point out is that you need to make sure you can keep all of your receipts for getting that care, because the overseas claims requires proof of payment. And we highly recommend that all traveling retirees obtain travel insurance to cover these upfront costs should something happen, because air medical evacuations can be extremely expensive, upwards of 50,000+, and they will need that money upfront. And if you have additional questions or would like additional information, you can check the tricare.mil/overseas website. Thank you.
Very good, thanks. Next question. Why is the digital mammogram not covered for those who have dense breasts?
Hi, this is Amber Butterfield, and the question was, why is 3D mammograms not covered for dense breasts, correct?
That's
Carrie?
correct. It
Yep.
said digital mammogram.
Oh, digital mammogram. As far as I know, that is available benefit. I can take that one back and provide more information if we can get the questioner's information.
Very good. Next question. I'm 64 and a retired Navy officer. I'll be transitioning to Medicare this year. My wife is a year younger than me. Will TRICARE remain her primary health insurance until she transitions to Medicare in 2021 when she reaches 65?
Yeah, so when an individual becomes entitled to Medicare, it does not affect TRICARE eligibility of the other family members. It's an individual program. I'm sorry. My name is Ann Breslin. I'm the TRICARE for Life Program Manager. So when the spouse attains the age of 65, she or he, depending on the circumstance, will then most likely become eligible for Medicare. Those who haven't worked can be eligible on their spouse's record. All this detailed information is available on our tricare.mil/TFL website. In the bottom right-hand corner are a couple of download documents. One pertains to those who attain Medicare at the age of 65, and the other is for those under the age of 65.
Great, thank you. Next question. I am retired, male, 83 years old. I live in Montana. In the winter, I live in Texas. Last year, I married a Canadian citizen who is also 83. We share 6 months in each other's country and don't intend on applying for permanent residency. She is not eligible for Social Security or Medicare, and we find it totally impossible to buy any medical insurance for her in the U.S. A, what is she eligible for as a dependent of mine under TRICARE? And B, also, am I covered while in Canada under TRICARE for Life?
Your spouse should be eligible on your record. Now that she's your spouse, she can file for Social Security and Medicare on your record. For the months that you reside in Canada, she would not receive Social Security payments. And so at that point, you would have to, you would get billed on a quarterly basis from Medicare for the Part B premiums. I think I've answered those questions. While in Canada, can you address coverage in Canada? Okay, so Medicare does not pay outside of the United States and U.S. territories, so your TRICARE would become your primary payer overseas in Canada.
And as a retiree, they would need to pay for that health care upfront in Canada and file for reimbursement.
Thank you.
Very good, thank you. Next question. I will be retiring from my civilian job in a year or so and plan on splitting my time between Massachusetts and Georgia. How does TRICARE work for snowbirds? Do I pick a primary care physician in Massachusetts and obtain referrals in Georgia if needed? I will be retiring with pay effective June 2020.
Hi, this is Shane Pham, and I work in the Policy and Benefits branch. And we've recently switched to an open enrollment where you get the opportunity to change your plan once a year. So the question would beg from Prime to Select. What I would recommend for a snowbird is to get Select. Then you can see any TRICARE provider in any area.
This is Francine Forstill, and I work in customer service. I'm going to add on to that. Under Prime, if you wanted to stay under Prime, when you're in Massachusetts, if you choose to enroll, when you move, you have to update your address in Deers and re-enroll in Prime in the new location in, I think it's Georgia. Then when you go back to Massachusetts, you'd have to update your address in Deers, and then you could, again, transfer your Prime enrollment. But when you are in Prime in, let's say, the north, and you travel to the south area location, if you don't transfer your Prime enrollment, then you would have to reach back to whoever is your primary care manager in Massachusetts and have them write referrals for any specialty care. Now, not all providers are willing to do that because they haven't seen you, they don't know really what's going on, so be aware of that. You either have to work on transferring your enrollment, and there is no guarantee when you have to transfer your enrollment that you'll be always able to be assigned the same PCM you saw when you were enrolled the first time. So I agree. I believe Select is the better option. You can see any TRICARE authorized provider in either location. You can, if you're traveling back and forth and need health care, you can do that as well. You just have to seek care from a TRICARE authorized provider, preferably a participating one, because then you'll pay lesser out-of-pocket costs.
And I would just say that Francine has made an excellent point with if you want to stay in Prime, you do have the option to, outside of open enrollment period, change your program if you've had a qualifying life event. And if you officially update your address in Deers, that's going to be deemed a move, which would be a qualifying life event, which would allow you to change to Prime in the new area. So thank you.
Great. Thank you, Shane and Francine. Next question. Due to a glitch in my retirement system, I lost Kaiser for 6 months until I can re-enroll. I have Medicare, which pays 80%. Does TRICARE pick up the remaining 20%?
So if you're enrolled in original Medicare, yes, Medicare pays 80% of their allowable amount. And if the service you receive is covered by both Medicare and TRICARE, TRICARE picks up the remaining 20%. Thank you.
Great, thank you. Next question. I am 100% disabled. Can I get TRICARE?
Sorry, this is Francine again from the customer service. Basically, 100% disability. If you were medically retired, TRICARE really works on the retirement system. It doesn't, your disability rating doesn't really have an effect on your TRICARE benefits. I would assume if you are 100% disabled that you were medically retired, but I'm not going to make that assumption because I don't do the VA's disability system. And if you are medically retired, then yes, you would maintain your TRICARE eligibility. Thank you.
Great, thanks so much. How do you know for sure if the doctor or the practice is in network? For example, I have one doctor that I go to, and I asked if they accept TRICARE, and they said yes. But now, after my appointment with them, they told me that I will owe 25% of my bill the next time I come in, which tells me that they are out of network, correct?
Correct. And so there are, each of our contractors have a network provider lookup tool, so you can check there. But even in that case, I would recommend speaking to the provider directly.
This is Francine, and I think beneficiaries asked, do you take TRICARE, which is one question. It really should be, are you a network provider with TRICARE? Because that's a totally different answer. And then, as she mentioned, the provider lookup tool, if you go to tricare.mil, that landing page, it says Find a Doctor, and there's where you can look up the network providers in each of the respective regions. Thank you.
Great, thanks. Next question. Is there a TRICARE insurance card to present to healthcare providers?
No.
Your
eligibility is verified with a copy of your military ID.
Perfect. Next question. My PCM has changed many times. Why is that? Also, what happens to all the referrals I have in place? Do I have to start all over and get them redone with a new doctor?
Hello, this is Francine, and again, in this instance, we're making the assumption that you're probably seeking care at a military clinic or hospital, and often the providers are as mobile as typically our service members themselves. And so you may end up changes in providers due to providers separating, going on exercises or deployments, retiring, transferring to another location. So that may be. There's also certain providers that cover certain areas. Maybe before you had a general practitioner and now it's determined maybe internal medicine is a better fit for you. But if you had one primary care provider and he or she leaves the facility, normally the MTF hospital or clinic would assign you another provider who would then pick up any future referrals and authorizations. Any that you already have in place should still be valid while you're still in the status that you are. Let's say, though, however, if you got those referrals as active duty and then you retired, if your status changes, you would have to get new referrals and authorizations as a retiree. So just be aware of that. Thank you.
Okay. Is it possible to purchase a supplemental Medicare policy for silver sneakers and dental and vision coverage without deactivating my TRICARE for Life coverage?
Yeah.
So I don't know if there's specific policies for silver sneakers. I'm aware that many Medicare Advantage plans offer silver sneakers. If you enrolled in a Medicare Advantage plan, you have to receive all of your care with the exception of emergency services through the network of that Medicare Advantage plan.
The TRICARE would still pay.
TRICARE will pay your co-pays for care received through a Medicare Advantage plan. Was there a second part of that question, Terry?
No, that was it.
Dental and vision.
That was it? Oh, dental and vision. So dental and vision coverage is available through FEDVIP, which is the Federal Employee Dental Vision Insurance Program. That began last year. Mm-hmm. And information is available on BENFED, B-E-N-E-F as in Frank, E-D as in dog, S.
This is Francine. I'm going to ask Ann a question. Do not a lot of the Medicare Advantage plans also have dental or vision coverage as well?
I'm not sure. You'd have to evaluate each one of those plans, and that information is available on the Medicare.gov website. Thank you.
Okay. Next question. What is the process for TRICARE Select with a medical doctor who does not participate with TRICARE? Does the doctor bill me and I pay them directly and then file a claim with TRICARE?
This is Francine from customer service, and yes, you do understand the process. A non-participating provider basically is saying they don't want to file insurance, they'll see you, and then you would then have to submit the claim to the respective TRICARE claims processor. The disadvantage to using a non-participating provider is that they can bill you up to 15% above the allowable charge, so you may end up paying more out of pocket. The other thing with a non-participating provider is that they sometimes don't know the TRICARE rules, what's covered, what's not covered, what do you need, when do you need referral authorization, et cetera, et cetera. And so sometimes it can be a little bit problematic, but if you are happy to see that doctor, then yes, you would pay out of pocket, and then you would be reimbursed the appropriate amount based on how TRICARE processes that claim. Thanks.
Okay. Next question. How does one remove a previous spouse from all TRICARE and DEERS records, married less than 4 years with that spouse?
And this is Francine, and regrettably, you can't. Once they're in DEERS, because they had an entitlement for the period that you were married to that particular individual, they have to show as eligible during that period of time in DEERS, and it does not go away. So sorry about that, but that's an eligibility personnel record, and that's how it works. Thank you.
Okay. I am a retired Air Force veteran. What happens to my spouse's TRICARE benefits should I die before her?
This is Francine, and basically if you die, your spouse retains their eligibility under TRICARE. Ideally, the death needs to be reported to the ID card reporting system so that they can, reflect your status in DEERS, because in the future, if and when your spouse, he or she needs like a new ID card or something like that, they would need to know why the sponsor isn't presenting the information into the system. They would have the same transition if they're currently, but under 65, they would become TRICARE for life when they turn 65. The only thing that would be possibly different is if they would remarry another service member, then they would need to be reflected as a dependent under them and transfer from under your Social Security number to that new sponsor's Social Security number. And that's all I have. Thank you.
Okay. Next question. My spouse and I currently have TRICARE Select. When I turn 65, I will become Medicare eligible and have TFL. My spouse is 10 years younger than I am. What are her options until she turns 65?
The spouse who is not yet 65 will remain eligible for TRICARE Prime or Select, depending on if you live in a Prime service area. And again, this is Ann Breslin. Thank you.
Thank you, Ann. Next question. May I use HSA funds to pay for TRICARE Retired Reserve monthly premiums?
This is Jeremy Schneider at the TRICARE Policy and Programs, and the short answer to that one is no, you cannot use those funds to pay them.
Okay. Next question. I have TRICARE Prime retired. How does your referral process work after you get an off letter? I was trying to make an appointment with the referred provider, but they said referring provider has to call them first.
Yeah. Hi, this is Shane from Policy and Benefits. And once you have the authorization, you've been referred, you have the authorization, you should be able to make the appointment. So I would have you call back to your managed care support contractor for additional assistance in that situation.
Okay. Next question. Having spent 20 years on active duty and have earned my retirement benefits, why am I required to enroll in Medicare to keep my TRICARE benefits?
So although many service members were told that if they served 20 years that they would have free health care for life, that issue was raised all the way to the Supreme Court, and the Supreme Court refused to hear that case because there is no law on the books to support that statement. So in 2001, the law was passed, or maybe it was 2000, it was effective in 2001, where TRICARE benefits were extended to individuals who became entitled to Medicare at the age of 65. Following that, we also included the under 65 entitled to Medicare. So before that law was passed, which extended benefits, individuals who became entitled to Medicare would have lost their TRICARE benefits and had to rely solely on Medicare. So yes, you do have to pay the Part B premium to extend your TRICARE benefits beyond the age of 65, but together with Medicare, when your care is covered by both programs, you have no out-of-pocket expenses. It's really a fantastic program.
Very good. Next question. I am enrolled in TRICARE Prime. I am also a retired veteran. I am near a VA facility where I live. Is there any restrictions in having both TRICARE and VA?
Yes, and This is Shane, and I work in the policy and benefits at DHA, so I'm not working for the VA, but I will say that they have their own set of rules for what normally it's in conjunction with your VA disability rating and what you can be, what's your injury and what you can be seen for there at the VA facility. So the easiest way to receive complete health care would be through the TRICARE benefit, in my opinion. And I'm going to have some friends add on.
This is Francine, and I want to add on that basically, if you get care at the VA, TRICARE can't pay on your claims, and the only way TRICARE would pay on a VA claim is if, as a prime enrollee, you were referred to the VA because they can serve as network providers in some locations. If you were actually referred to be seen at the VA as a prime enrollee. But you can't mix episodes of care. If you start getting therapy or surgery for your knee with the VA, you are not supposed to transfer over to TRICARE until that episode of care is done. So you basically have to choose which location do you want to go to. You also may want to do some research on your VA benefits because your copays and cost shares, if it's for your debilitating condition, you have very minimal, if any. So you have to do a little bit of research both on the VA website and on the TRICARE website.
And this is Ann Breslin, again, the TRICARE for Life Program Manager. With respect to individuals who are also entitled to Medicare, Medicare cannot pay for any services received within the VA system. Therefore, we encourage those with TRICARE for Life, if you need care that is not service connected, we recommend that you get your care from civilian providers, Medicare participating or non-participating providers. If you receive non-service related care at the VA, TRICARE will pay up to 20% of the TRICARE allowable amount, and you'll be responsible for upwards of 80% of that bill. So it's a very costly decision. So please, if you're TRICARE for Life, obtain all non-service connected care outside of VA facilities. Thank you.
Okay, next question. I have tennis elbow 4+ months and counting, and wanted PRP injection to help resolve the issue. The stem cell provider, which accepts TRICARE, refused to give it to me because he feared they wouldn't be reimbursed enough to cover their costs. What is my recourse?
Hi, this is Amber Butterfield. And if you received a denial from a provider for PRP services, I would recommend contacting your regional contractor to see if you could find another provider that could offer you that service.
Okay, next question. I am retired military and retired federal employee. My wife is still working, and for the last 2 years I have been on her medical insurance with TRICARE as my secondary. I am pretty sure that when I start Medicare in a few months, I want to be on Medicare A and B with TRICARE for Life. However, I want to know if I can stay on my wife's insurance until she retires without experiencing any penalties.
Yes, Medicare allows individuals who are covered by employer-sponsored coverage based on current employment, either your own employment or your spouse's employment. Medicare will allow you to delay your enrollment in Medicare Part B and will not assess the late enrollment surcharge or higher premium when you do sign up. You need to sign up. You can sign up anytime while your wife is working and you're covered by her insurance, or within 8 months of her loss of employment or loss of that employer-sponsored coverage, whichever occurs first.
And question, who becomes the primary payer then?
So the primary payer would be that federal insurance, because whoever is currently working, that insurance becomes the primary insurance. Thank you.
Very good, thank you. Next question. I am 64 and turn 65 in 8 months. How far in advance of turning 65 should I register for Medicare, and what options should I select?
Does he have to?
Okay. So before I take this question, I have to add on to my previous question or answer with respect to the employer-sponsored coverage. When you don't take the Part B, you're entitled to the A. So if you don't take the B, you would not have TRICARE as a secondary payer to that federal employee health insurance. Just to clarify that. And then for the current question of someone who will be turning 65 in 8 months. So each individual has what's called initial enrollment period. It's a 7-month period in which you can enroll in Medicare. For simplicity, I tell everyone to sign up no later than 2 months before the month you turn 65. If everybody does that, your Medicare Part A and Part B will be effective on the same date, and you'll have no break in your TRICARE coverage. So at least 2 months before, sign up for Medicare. If you would like to cut it closer or see more details on the initial enrollment period and that timing, please go to the tricare.mil/TFL website, scroll down to the bottom, and the downloads there will provide you all the specific information that you'll need. Thank you.
Great, thanks.
This is Francine, and basically, wait, I'm going to interject. I apologize.
Sure.
Terry, I apologize.
You're fine.
The other thing you can sign up for Medicare either online or going to a Social Security Administration office. So the online, you go to Medicare.gov, or do you have to go to SSA? You have to go to the SSA website, and then you can go ahead and sign up for it online. Thank you.
Okay, next question. How does applying for Medicare at age 65 affect my TRICARE status?
Okay, so make sure you apply before you turn 65, 2 months before your 65th birthday. When the Medicare is effective, which will either be the first of the month you turn 65, if your birth date is any date other than the first of the month. However, if your birth date is the first of a month, your Medicare coverage begins the month prior. So, how does that affect your TRICARE? At that point, Medicare becomes your primary coverage, and TRICARE is secondary. Your providers will bill Medicare, and Medicare will process that claim, pay their portion of the claim, and then forward it on to our TFL or Medicare contract, our TRICARE for Life contractor, to process and pay the TRICARE portion of that claim. And as I mentioned previously, if the care you receive is covered by both programs, you'll have no out-of-pocket expenses. If it's covered only by one of the programs, you will be responsible for the deductible and copay of the program that pays. Thank you.
Great, thanks. Next question. I have a question about a provider being PAR. We have TRICARE, gray area retiree, and have had the same primary care provider for years. We have had problems where if my husband sees one of the providers there, it is billed as in-network, but we have also had it billed as out-of-network. We don't understand why, and the practice states they have never been PAR. We are not in a TRICARE-heavy area, so I'm unsure how knowledgeable they are. Lastly, are the in-network and out-of-network deductibles two separate amounts? Do we need to meet both if it comes up? I can't seem to get the same answer twice from Humana.
Okay, so I'm going to give you some basics, and hopefully this will be understood. So you want to see a network provider, and if you think you're seeing a network provider, you need to confirm that they are a participating provider. You would think network provider should be, but it sounds like there's a mix-up in this facility. I don't know. Provider.
This is Francine, and basically I think what may be happening, I'm going to interject here a minute, is when they say they're non-PAR, that means they basically are not participating. But each provider on its own claim can choose to whether or not they want to participate. So if Dr. Jones wants to participate on the claim and accept the TRICARE allowable amount as payment in full, he or she can do that. If Dr. Jones doesn't want to participate on a claim, he doesn't have to indicate that on the claim, and therefore you would pay the non-network rates for that provider. And it's really not, par and non-par don't really have anything to do with network versus out of network. Anybody that's a participating provider who is not a network provider, you would pay the out of network rates. The only time you get the network rates, in-network rates, is when you use an actual contracted network provider. So you can say we have this big umbrella of TRICARE authorized providers. We have TRICARE Prime providers who are contracted to see TRICARE beneficiaries. We have TRICARE participating providers who choose to accept TRICARE allowable as payment in full based on when they submit their claim. And then we have the TRICARE non-participating providers. So it might be on a provider-provider basis that you're seeing the difference.
She's exactly correct. So, and a provider can...
Oh, she asked about the deductible.
And the provider can participate and not participate. The same provider can choose to do that whenever. So always ask.
You had a second part of your question where you asked about the deductible. There is only one outpatient deductible for retirees, but it can be based on both your healthcare costs as well as your pharmacy costs. So it's not whether you use network or non-network. Both of those payments apply towards your deductible, but the deductible is always your upfront cost at the beginning of each calendar year, and it's based on typically if you are seeking outpatient services as a retiree. Thank you.
Great, thanks. Next question. I am medically disabled vet, 90%. I am retiring soon, 2 months, from a non-military job. I am 63 years old. When should I sign up for TRICARE?
Terry, would you mind repeating that question for us, please?
Sure. I am a medically disabled vet, 90%. I am retiring soon, 2 months, from a non-military job. I am 63 years old. When should I sign up for TRICARE?
So someone who's a veteran may not be a TRICARE eligible beneficiary. So the first step might be to contact DEERS, and their phone number is 1-800-538-9552. They can tell you if your DEERS record reflects an entitlement or not, and if not, you would need to go to contact your service personnel office for determination if one hasn't previously been made. Anything else? That's it. Thank you.
Great, thanks. Any chance Military Health will consider extending coverage for mobile CPAP machines for retired personnel, not just active duty personnel?
Hi, this is Dr. Black, and at this time, portable CPAP devices are considered convenience items, and so the standard CPAP device is the covered benefit. As I mentioned in my talk, that there was a special decision made for active duty service members based on medical readiness issues, and also because with deployment and a limited amount of space that they have and weight, that having the smaller device would improve compliance, which will lead to improved medical readiness. Over.
Very good, thank you. Next question. Does TRICARE Prime Retired cover vision acuity testing with correction prescription during the covered eye health exam every 2 years?
No, they don't give prescriptions. They just tell you if your eyesight is good or bad.
Very good, thank you. Next question. I will switch to Medicare soon. My retired Air Force husband a year later. Does making changes with DEERS switch my TRICARE billing from the family plan to an individual plan?
So it depends on how many members are in your family. If it's just the husband and wife, the individual who remains in Prime or Select would have an individual enrollment fee. If there are children also that remain eligible, the family enrollment fee would remain in place. Thank you.
Very good. Thank you. Next question. As a retiree, how does the catastrophic cap work for me and my family?
Definition. Basically, the catastrophic cap is that which limits, it's a limit that you have on how much you would pay out of pocket for TRICARE covered services. And the way the catastrophic cap works is, first of all, there is an individual and a family deductible that each individual and a family has to meet that get applied towards that cap. $150 per individual, up to $300 for a family. Then, once the deductible, if you have one, gets paid, any other additional cost that you have for TRICARE covered services gets applied towards that catastrophic cap. So if your copay is $20, if your cost share was $50, all of that accumulates, and everybody that's in the family accumulates towards the family catastrophic cap. For retirees, if it's Group A, it's $3,000. If it's Group B, where that means you came on active duty and retired after 1 January, is what is it? $3,655. If you're an active duty family member who chooses to be in Select, and typically are paying some out-of-pocket costs, and or even if you're Prime and you're paying for prescription medications, the catastrophic cap for a Group A who is someone who came on active service and retired before 1 January of 2018, your catastrophic cap is $1,000 for the family. And if you were Group B, where you came on active service and also then retired, which is typically a medical retirement, both occurred after 2018, then your active duty catastrophic cap is $1,044.
Okay, thank you. Next question. I am a retired veteran eligible for and using TRICARE. My wife is a contractor. Her employer is telling her that she must enroll in their health insurance program, that a ruling was passed over 4 years ago that as a service contract employee, she is prohibited from using TRICARE as her primary coverage or face a $5,000 penalty. If TRICARE is acceptable and we are considered covered under the Affordable Care Act, does she have to enroll in her company's healthcare program?
Hi, this is Shane, and I am not a lawyer, but there was a law passed that, and I'm going to muddy the water, but I know that the employees could not pay the employer could not pay the employee to take it, to not take it. So you see, I'm obviously wishy-washy on the details, but what she should be able to use it.
Well, it could be also the condition of his employment, because employers have to have, if they have so many employees in their company, they have to provide health care coverage. So it could be that they're telling her, you basically have to get our health care plan because it's our requirement as a condition of employment as well. But they can't say, okay, you're TRICARE, so I'm going to pay you $200 to just take TRICARE so I don't have to pay for your health care insurance. That's the example that Shane was giving there.
Yeah, and that was the law we're familiar with, or slightly familiar with. Mm-hmm. But the situation going on here may need more explanation from their legal side of the house.
You may want to reach out to your state health insurance. Each state has a board or something for state information on how things are to work in your state in terms of insurance. And so I would advise looking for that organization in your state and verifying the requirements.
Okay, thank you. Next question. This is concerning the contractor's privacy department. When requesting an accounting of disclosures from a contractor, specifically Humana, what information should an active duty family member expect to get?
Terry, we're a little unsure of what this person is asking. Could you repeat it one more time?
Sure. This is concerning the contractor's privacy department. When requesting an accounting of disclosures from a contractor, specifically Humana, what information should an active duty family member expect to get?
This is Francine, and I think basically you have to be very specific in what you're asking for as far as disclosures. I know for sometimes when we're looking for information, like according to the Freedom of Information Act and HIPAA, you have to identify by name, by identification, whether that's the sponsor's SSN or the individual's DOD benefits number. You have to identify the dates, the types of services. So it all depends upon, what disclosure are you looking for, or when are you looking for it? And basically what it would do, disclosures basically indicate when information is released outside of the plan. If you look at the HIPAA law, we can share information with providers that are delivering services. The contractor and the claims processor can share information. So if you're questioning a particular incidence of, you think somebody found something, it's that sort of thing. We can share with police and legal agencies if there's a question of harm or injury. So under HIPAA, there's a number of rules of when we can and cannot release information. So I think you can't just say, oh, I want all releases of my information.
They're going to track the disclosures that are outside of the normal processing your claims, taking care of your health care releases. So you're not going to, as a dependent, ask for all the disclosures and get this massive list of every single person who's seen your privacy, your PII or PHI. You're only going to get that information where it was outside of those normals or allowable, shall we say, per law, per HIPAA.
Very good. Next question. I'm retired from the post office, but still kept my civilian insurance. My husband turns 65 next week. Will TRICARE be his third insurance as Medicare is his primary?
Yes, TRICARE is the last payer, so it would be Medicare, then your federal insurance from your employment with the Postal Service, and TRICARE last.
Great, thank you. Next question.
Terry. We were going to add one thing. I apologize. I didn't raise my hand soon enough in the room. I apologize. What can I say? Now I forgot what I was going to say. Medicare, primary, secondary, third. Oh, if you want TRICARE to pay on any claims, let's say your commercial insurance doesn't cover something, Medicare will only exchange information with one other payer. So they would always send it to whoever your employer insurance is. And if they say, well, we don't cover this, then you would have to submit a claim to TRICARE for Life with a copy of your Medicare summary notice to see if TRICARE would pay.
And the denial notice from the second insurance.
Right.
So on the WPS it's TRICARE, the number 4u.org.
Com.
It's .org. Com. So TRICARE, the number 4, the letter U.com is the website for the claims processor for folks who have Medicare. If you go on there, you can see instructions on what information is necessary when you're filing a paper claim. Thank you. Very
good. And I have a few questions here that appear to be very short, and we may be able to get them squeezed in before we hit the top of the hour here. Is TRICARE Select a plan that you have to have an open enrollment every year?
Yes, by law now, there has to be open season enrollment. You can also enroll if you have a qualifying life event.
But once you've enrolled during the open enrollment period and you want to remain with TRICARE Select, you do not have to do that every year.
Okay, next question. I'm retired, have a child who is 19 years old and is attending college. How long is she covered in TRICARE?
It depends on some specifics. It would be 21 or up to the age of 23 if she's in school, and then also up to the age of 26 if she enrolls into our TRICARE Young Adult program.
Very good. And let's see if we can get one more here. If you get knocked off of TRICARE Reserve Select due to your ETS date changing, how do you re-enroll?
Terminate service.
This is Jeremy Schneider again. So if we're saying that the ETS date got extended, this would be going back through your personnel office and working with them to update your eligibility, and then you would be able to re-enroll in TRS.
Very good. And I think that puts us right up on our time here, folks. Any last comments from the panel before I close us out?
This is Francine speaking for the group. Thank you very much for participating in today's session. We hope that you got questions answered, exposed to additional information, and so we appreciate your participation and look forward to doing these same kinds of things in the rest of the upcoming year, or the rest of this year. Thank you.
Very good. Thank you so much, Francine, and thank you very much, everyone. I want to thank our panel for sharing their invaluable experience and expertise. I would also like to thank our attendees for participating in today's webinar. Now, if we didn't answer your question today, please refer to the contact information in your copy of the webinar slide deck. And also, you can find many of the answers to questions about TRICARE on the TRICARE website at tricare.mil. This concludes today's webinar on Ask TRICARE.